For 15 years, I ran community-based programs and saw people with multiple challenges getting stuck in, even hurt by, systems that were supposed to help them. People I knew and loved died. I became convinced that breaking cycles of poverty, violence, and trauma meant going beyond helping people change their lives. It meant changing the systems that were dominating their lives. A few of us asked a basic question: what helps people with complex, crisis-filled lives achieve well-being and thrive? FFI grew out of these discussions, committed to applying lessons from what's already working across systems and organizations to support people with multiple challenges make lasting change in their lives. Our mission is to change systems so people in communities experiencing poverty, violence, and trauma have the tools, supports, and resources they need to thrive. We build the capacity of nonprofits to work with people in the full frame of their lives through technical assistance, training, and convenings. Through research, writing, and presentations, we disseminate knowledge about the effectiveness of a full frame approach. And we help public and private funders to be more effective by explicitly aligning and integrating systems with our 5 domains of well-being: social connectedness, safety, stability, mastery, and meaningful access to resources. To do this requires funding. And sometimes the window of opportunity is really short. Our success depends on having funding in advance of opportunities to respond quickly. Our top 3 leverage points are existing changemakers, a simple framework for making human services more effective, and the urgency of the times. First, FFI partners with public systems, nonprofits, and communities that are hungry for a better way, and we bring the 10% that makes their 90% work better. Second, our simple framework called the 5 domains of well-being can be used across issue areas, such as domestic violence and juvenile justice, to help systems work more efficiently and effectively. Third, public funding is dwindling while community need is growing. This calls on all of us to do better with less. Because FFI has identified what works by learning from existing organizations, we're bringing forward solutions that are both new and proven to meet the urgency of the times. FFI is a small organization, but we're achieving national impact by catalyzing change, spanning the boundaries of fields and issues, and fostering change agent partnerships nationally. Both our action and knowledge bridge fields that overlap in people's lives, but are usually compartmentalized, like homelessness, violence, addiction, or poverty. FFI's earned credibility in the worlds of policy, academia, and community-based practice, and has been described as a booster rocket for permanent constructive change. We support and catalyze emerging change efforts driven by community partners and government allies. They incorporate our 5 domains of well-being, and there's a ripple effect when they share their experience and new tools with other organizations and systems. FFI tracks the number of state systems actively using our 5 domains of well-being to support reform efforts. We track the number of organizations working with us to document and improve their practice and help each other be more full frame. And already, we're starting to be able to track the positive changes that happen in lives and communities when systems and organizations reorient themselves around our 5 domains of well-being. Systems in 3 states are currently using our 5 domains of well-being. We've identified scores of programs nationally who are or want to be full frame, and public and private funders seek us out to help them initiate systems change. There are 2 things. First, in a world focused on specialization, our projects span many fields. Our ability to generate and apply knowledge across issue areas is an extraordinary strength that few organizations have and few funders understand. But our insistence on breaking silos to get effective results can be misconstrued as diluted or scattered. Second, we use many tactics and tools to accomplish our mission: technical assistance, advocating with public agencies, researching, writing, developing materials, and new evaluation approaches. Among our biggest challenges is that we're often defined by the tools we provide, technical assistance provider, not by the change we're actually making with those tools. FFI is at the forefront of identifying and communicating what works best to break cycles of poverty, violence, and trauma. Human service systems and organizations from around the country seek us out to help them better support people with multiple challenges. Changemakers in government, philanthropy, and community-based organizations work with us to increase their impact. A couple examples. Missouri's juvenile justice system sought to make its already strong practice even more effective, realigning treatment and reentry around our 5 domains of well-being to support positive youth transitions. Massachusetts public agencies are integrating domestic violence, sexual violence, and housing systems using our 5 domains of well-being. But I think our biggest accomplishment is that we're changing public perceptions about who can be helped and what that help actually looks like. So aside from challenges any young entrepreneurial organization faces, FFI confronts deficit-based thinking and siloed systems. So while viewing individuals in terms of their deficits can build programs, it doesn't help people, and it only fuels stereotypes that some people need to be written off. Now, someone might wrestle with issues like poverty, violence, and diabetes at the same time, but the issues are seen and treated as disconnected. Well, I don't have this part of me that's a violent survivor, and this part of me that's a diabetic, and this part of me that's unemployed. Nobody does. FFI's growing success is an important ingredient in shifting thinking to see assets and strengths in all people and to change systems to address the complex reality of people's lives. With additional resources, we'd make more change. We would respond to the growing demand for our expertise. FFI is proving that better outcomes and lasting change are possible for people involved in multiple systems, and better outcomes mean better lives, more efficient use of public and private resources, and fewer people caught in a revolving door of human services. Getting better outcomes doesn't have to cost a fortune. For every $100,000 invested in FFI, we can catalyze positive, lasting change in over $10 million of public systems. There are many service systems waiting to partner with us. The demand is there, the will is there. What's needed is funding to support the capacity building and technical assistance FFI provides. People in communities dealing with poverty, violence, and trauma also have high rates of chronic health problems, such as hypertension or obesity. But healthcare and human services are usually parallel, segregated universes. So expanding into the healthcare arena to help bridge that divide is a logical next step for FFI. In fact, a growing body of research from multiple branches of medicine and public health show that each of FFI's 5 domains of well-being is essential to people's health. And some of the groundbreaking, effective strategies for treating chronic diseases are less about adding more medicine than they are about dealing with people in the full frame of their lives.